We are doing far more in these sectors, as we are in every other sector. We're doing far more than we've ever done before. We're building more schools, building more hospitals, training and recruiting more teachers and nurses and doctors. We are buying more textbooks, providing more school meals. We are buying more drugs and medical supplies. We are rolling out more modern world-class equipment in our hospitals, including, of course, digital equipment, digital x-rays, other digital scanning and imaging equipment, telemedicine centers that Minister Frank Anthony spoke about, etc. So we're doing far more, and we're doing it far better. But President Ali has also said that this modern Guyana that we're building must not only be a modern Guyana in terms of the things that we see, newer, bigger, newer, better equipped hospitals, etc., but it must be a more modern Guyana in terms of the things that are not so visible, like, for example, the qualitative changes that are needed in the citizens' experience in accessing government services and in the quality of services that they access and the ease with which they access these services. And those qualitative things sometimes are not, or oftentimes are not as visible. They're not as visible as the brand new hospital building and the brand new hospital beds and the brand new school buildings and the brand new smart classrooms that we're deploying. They're not as visible, but they're just as important in realizing a world-class education and health service. And so what we had today under President Ali's leadership was a full and frank and exhaustive, not exhausting, I don't think any of us got exhausted because it was such an interesting discussion. But what we had today was a full and frank and exhaustive discussion, comprehensive discussion on some of the critical issues that we need to pay attention to make sure that we raise the quality of service that is provided in these two sectors, and some of the minimum standards that should be set and that we're now setting in terms of service delivery in these two sectors. The transformation that we're experiencing today must not only be seen, must not only be experienced, and must not only be benefited from in our major urban centers or only on the coast, but must be experienced and felt and benefited from across the country. And so, gone are the days when you can only get access to good quality health care if you come to Georgetown. Or gone are the days when you can only get good quality education if you come to the coast or if you come to Georgetown. And I know that, and we have seen the President's conviction that good quality health care and good quality education must be available to all of our citizens, no matter where they live, no matter which region they live in, no matter, first of all, if they live in an urban center or a rural community, no matter if they live on the coast or in the hinterland, no matter if they live in the most remote village in Guyana. Good quality education and good quality health care must be available to all of the citizens of Guyana.